Hi, this is Bill White, and I'm going to try to record one of our programs here, and we call it Aids in Doing Orthodontics, or just little tricks of the trade. These are little things we've come up with over the years that might help you at various things. Some of them won't be interest you at all, but others they may. uh, for many years we used a very, very small bracket, and this way it's called a single bracket, and it's put on with little elastics like any other bracket, and I'm going to kind of draw on this as we go along. And one of the big benefits of this single bracket is that you have a large inner bracket space in here, and that allows you to bend the wire a greater amount when you engage it into the bracket slots here. This is a big advantage, and so you can use slightly stiffer wire a lot of times because you have more space to bend that wire into. These little brackets have a vertical slot in them also, and you can take a hook, run it down through that vertical slot and just bend the end over, and then you can hook elastics to them any way you wish. You can wear, midline elastics, or you can wear Clas 2 elastics, or you can have these little hooks on various teeth. You could even use Clas 3 elastics with them if you wanted to. They're pretty handy. That's just a added thing with these small brackets. We bend all of our arch wires and use an omega on the back of the arch wire. This is a little bend in the wire that leans forward like that and allows you to tie the arch wire back. So you tie one side very loosely, and then you go and press on the other side. You take a ligature director. It has a little V shape, and they point it right here and push it against that omega, and you push on it real hard and then squeeze this tie back up and twist it down. You can see how we've twisted it here, and that'll tighten the wire all the way around the mouth. You can actually blanch, if two teeth are separated in here, you can blanch the tissue in this area by just squeezing that together, so we close spaces a lot of times in arches just simply by tightening up these omegas. And we'll show you how to bend omegas in the arch wire later on. Now this is a round wire. As soon as you get worked up in your where you can run a rectangular wire, we like to finish all of our cases. By the way, these are 018 slots in the bracket. In other words, the brackets in here, in this slot in there is 18 thousandths wide, so we can't insert a wire bigger than 18 thousandths into these. Normally we'll use in rectangular wire, we'll use a 17-2-5 arch. That's, in other words, it's 17 thousandths in the vertical direction, and it's 25 thousandths in the horizontal direction. It's 25, and this is 18 or 17 in that case right there. We use relatively small wires, and then we do bigger jobs with things that are with wires that are larger. We put piggyback wires on top of these frequently. So these are just some little aids that we do, and I'll point out some more of them as we go along. These are tiebacks and bending these omegas, and you can close any space you want to in a dental arch by just tying the arch wire back tight. If you choose to do it that way, we can close in several other ways. And we never do run the arch wire back here and cinch it down like a lot of people do, because In other words, you want to change the arch wire, then you've got to cut this cinch off, and then you have no way to tie it back other than just run the elastic chain from molar to molar, something like that. So we bend omegas and tie back all the arch wires, and then we can cut the end if we want to right off flush with the end of the bracket. You can take a pair of flush end cutters, like the blade on them will be something like that, and you'll have a blade on the opposing part like this, and the arch wire will be going through here, and you can reach back right behind a molar tube or whatever and just cut it, and it'll cut it right off flush. Now if you have distal end, this is a distal end cutter, and if you have a distal end cutter that holds the wire, then it's a different tool entirely. It goes up, comes over, and has a little notch in it, and the upper one coming down has a notch like this in it, and it cuts the wire where these two notches pass, and then this grabs the end of the wire and holds it so it doesn't shoot it out the back. This type, you'll always have a little piece of wire protruding out the back of the second molar, wherever your arch wire ends. This can hang on the tissue and various things, so a lot of times we want to have a flush end cutter that just slices it off right behind the molar tube, right in here. You just slice that arch wire right off there and leave nothing sticking out at all. Now if you're closing spaces in the arch, you tie this back, this omega gets closer and closer to the molar. As you tie it back, then this will stick out again. You may have to cut it off again to take it out. That's a convenient way of doing this. This is just a kind of a blown up section that looks like these arch wires here were cut with a plier that holds the cut part of the wire. If you're using those flush cutting pliers, then you have to take a Matthew needle holder and get a little pledge of cotton and put it behind it. When you cut it, it'll shoot that piece of wire into the cotton, and you don't have to scratch around in there and digging around to find it. Sometimes it'll shoot it into the tissue if you don't. This is a blown up view here, and it gives you a little better view of the tie back wire. Now this is a soft stainless steel wire here, and usually we keep 3 spools of soft stainless steel wire. The one that we tie the brackets in, if we ligature the bracket in, we'll do that with a 10/1000. That's that'd be 010 soft stainless steel. The tie backs we use 12/1000. Like we'll take an 012 wire, and that's a tie back. Sometimes we want something a little stouter than that, like we may make these Kobayashi hooks, or if we want to really tie something back tight, we'll use a 14/1000 wire, which is like 014, and it's a heavier soft stainless steel wire. Anyway, these are 12/1000 right here, and you hook it over the back of the bracket and bring it up, and then you push on the omega with a ligature director, which has a kind of a V in the end of it like this, and a fairly long handle, so you put that V right on this and just push as hard as you can. Or the first, on one side you want to just tie it passive, then on the other side you tighten it up, otherwise your whole arch would slide through the brackets over there, and you would make the arch kind of lopsided. If you slide one side back further than the other, then the center moves over to the side, and the arch develops a kind of a skewed shape to it. You want to keep your center of the arch wire right in the center. So you come in here and tie one side back, and then you come over and tie the other side back tight. It won't give much over here as you tie it back. And then from then on you tie back one or the other, but keep the center point of your arch wire at the center in between the centrals up here. That keeps the curvature of the arch in the same spot all the time. Otherwise the center curve moves to one side or the other, and it kind of messes up the shape of the arch itself. You can do all sorts of things with these and tying this back. Now you can close any space in the arch if you want. And this type of dot, we got a little space between the first and the second molar up here. If we were doing this in real work, we would run our tie back behind the second molar and come all the way up here, and we'd tie this back. Now that's one good point for leaving a little bit of the wire out. If your tie back would slide under this wire back here, and you could tie that tight, it would pull this molar forward. We also, in closing something like that, we have lingual buttons on the medial lingual side. So on the other side is tooth on this button, but I'll just draw it on the buckle side here to illustrate, and then we'll hook an elastic chain on that and come up and hook it over here, and that'll pull the teeth together from the lingual side. If you're going to have some tendency for the tooth to rotate in this direction as you tie them together. It won't bother this one, but this one might rotate some. You can straighten it out later on, but if you just close from the lingual side as you go along, it'll bring the tooth just right straight up in this area. So that's just another little trick that we use in there. Nothing particular, it's just the other side of the mouth. Now we'll blow this up a little bigger, and you get a little better insight into tying the arch wire back. We take a Matthew needle holder and just a little point out here, and we put the tie back in there, and we kind of go up and turn it out like that. It comes up and comes back down, and you can bend that straight up, and then you can hook it over the back of this and pull it underneath here, pull it up here, and then you take your ligature director and shove it back here and tie the thing. Now when you clip it off, your twisted part of your wire, you want to tuck it in where it can't be pulled out and get caught with a toothbrush or something like that and sticks out into the cheek. If that does happen, I tell people just take a regular old toothpick and just break the thing in two and take the end of the blunt end of that toothpick and push the wire in to get it out of the way in case it comes up there and pokes you in the cheek. Now, this one thing we learned several years back is that if you will take your brackets that you have put on your molars and have them put them 3/4 of a millimeter lower on the on the band, that saves you a lot of trouble. If your bracket is up high, frequently the cusp of the upper molar comes down and hits the bracket before the two teeth come together in here, and that messes up a lot of your occlusion and trying to line the teeth up good, and it tends to break off your brackets, especially when you get on the bicuspid things. Then if you seat these like 3/4 of a millimeter lower, then you bracket your bicuspid 3/4 of a millimeter lower, and then it's kind of, you can either work it out as you go around, or you can just keep everything a little lower if you have room on the clinical crown. Now sometimes the clinical crown on young people is very short, and so you have to push the tissue down to bond them, or you can raise it up. But you can have one level in the molar area and then go up to the bicuspids if you need to. I like to keep the bicuspids low too as I go around the corner, and I just bring it all the way to the other side. So we just keep our lower arch wires slightly lower on the tooth. This is something that helps out a lot, and you'll find that you break off a lot fewer brackets when you have your tubes on your molars bonded about 3/4 millimeter lower than they normally put them on there. Here's just a blown up section of the tie back. Now this is the upper 6-year molar, and I might as well talk about the other aids and things in doing orthodontics the way we do it, is that we have triple tubes up above, and we have just double tubes on the lower. Now this is a headgear tube. It's an 045 tube, and you can stick a 044 wire in it, or an 045 on headgears and stuff like that. This conventional, your regular tube right in here, and this one, this is your exterior alternate tube above it. They are like 18.25 in dimension. In other words, they're about 25 thousandths this way and 18 thousandths in the vertical. And the second tube, or the conventional one that you normally use for your arch wire, is always convertible. Now you can't detect it very easily, but if you look where this is a strap that's put over the top and makes this a tube, but actually it's just a strap added to it. And if you need to put any bend in your arch wire back behind your 6-year molar to go in the second molar, then you'll have to convert this over right there. You need a special instrument to go in and peel this off, or you can make your thing. You can take a Bart Parker blade that has a number 12 cutting surface, and you can actually put it in underneath this thing and kind of peel that off with a Bart Parker blade. But it's a lot harder to do. You have to, grind the blade off so it's not cutting anything. But they make a stripping instrument that slips over the back of the arch, and if you just peel this off, I'll show that in another part of the program. Okay, this is the auxiliary. This is the bracket on the lower arch, and this is the one we put 3/4 inch lower. Now this is just a 2 bracket, 2 slot deal. This is the auxiliary one. We use this for lip bumpers, intruding arches, and certainly expanding arches, and step downs, and we use it rather frequently. This is your conventional arch, and on the lower we always band the second molar back here, and so you'll have a tube on it and have it placed the same depth low, down from the occlusion. The tooth would be going up in this direction, I'm sorry. And so this just gives you an illustration of the lower bracket that we use. Here they are, the two together, and there I've tried figuring out some way or another to put a third tube on the bottom for big lip bumpers or things like that. but it made it so awkward, and you would tend to chew on that thing, and then when you had to convert this bracket right here, it made it even more difficult to do that. So we just end up getting by with 2 tubes on the bottom and 3 on the top. If you'll do these, it gives you the ability to treat with 2 arches in many things, which speeds up your treatment. Alright, here's some little caps that we had one time as the guy was making them, that you could put over these little brackets. They had a little thin skin that went over the whole top of the thing, and this just snaps your bracket inside here, and it really hid the brackets quite a bit and made them a lot more comfortable. They have these little, call it little caps that just snap over the bracket. And if you had them very opaque or tooth colored, you didn't see much but the arch wire, which helped. But then if you put a hook in them, you had to use a regular elastic tie to put the hook in. Now here's another thing that you can put into these auxiliaries, are little rotating springs, which we use those in big a good bit, but I really don't like them. The spring would be out over on this side, you bring it over here and hook it on the arch wire, and of course it rotates this tooth in this direction. It pushes right here against the tip of the tooth and rotates it down this point right there. They're okay, but they bulge out and to me they kind of irritate the lips a little bit. So anyway, we rarely ever use any of these rotating springs. Now we can use little rotating wedges that we put underneath here, and it pushes on this side more than the other side. And that's the way we rotate with this particular type of bracket. But you can see how we would come in and put these springs. I'll go back to that deal, and your bracket will be sticking out here somewhere. And we put those springs that are way over here in your arch wire. You have to have a pretty flimsy arch wire to go in there like this. And your spring, your rotating spring, goes through this vertical slot. That would be the base of the bracket here. And you bend this part around over and hook it on this side, and this little tongue is touching out, so it pushes quite hard against the distal of the cuspid. Now, before you even think of rotating something like this, of course you got to have some space in here, and so as you try to open this space, in other words, you would come in first and put some coil spring in this area right here. And that coil spring would help, and you could actually have your arch wire expanded, and you want room enough for the tooth to turn before you start really exerting a lot of force on it to turn it. You can't put these 2 teeth in this area unless you enlarge this whole area out here somewhere. So we do the expansion before you do the rotation in this. But anyway, we put those little springs on there, and you see we've got room enough now to do it. This is a rectangular wire, and we've got a little V bend in it, so the wire itself is trying, when you tie it down, it's trying to rotate this tooth in this direction, and it's done part of it here. Now this little rotating spring will continue to push that and bring this out. And so this is a method of rotating. A much better method of rotating we'll show you on rotating teeth, where we hook a chain elastic onto the arch wire and run it through and under a little hump, and come out and hook it on the bracket over here, and it actually spins the tooth kind of like cranking on a lawnmower. It's a more efficient rotation method. We'll show that later. But anyway, this is one pretty good way to rotate teeth with little narrow brackets like that. here we show you the different bends in the. Now, any kind of in or out bend, we would call it a first order bend, where you go in or out or up and down, maybe the first order, then in and out is the second order bend. I better take that back. And then torquing is the third order bend. So anyway, we're going in and out with the teeth, and they build these brackets. All brackets are made where normally the lateral bracket is thicker than the cuspid bracket, because the cuspid is a lot thicker from the labial to the lingual than the lateral is. And so they make the lateral brackets thicker, but these are certainly not thick enough, and these are not thin enough to line these two teeth up. In other words, you need that lateral brought in a little bit to keep the incisal edge of this stuff. Well, I'd have to bring it back out again to do that. So we've reduced this bend up here and bring the lateral forward. It needs to be brought forward over between the central also. But frequently you have to do these second order bends in order to keep the incisal edge of the teeth lined up all the way around. And so you tie them in tight, or you want to rotate that some, you tie that. See, that arch wire is not fully down into the bracket slot at this point. Right here, you can see the difference in it. Now, on lower anterior teeth, you can actually lower the brackets on adults down quite a bit lower. In other words, you don't have any rule that says, well, you've got to be so many millimeters away from the incisal edge of the teeth. You can put them down on the gingival line if you want to. Now, sometimes when you come around the corner, you put the cuspid down lower and the bicuspid lower, or you can pick them up as you go back toward the molar and just have them actually come out even with the molar as it goes, but we've got our molars down lower also. In other words, you can virtually hide the lower anterior brackets if you want to on some adults with long clinical crowns. A kid with a short clinical crowns, you can't do that. Alright, this is just a rotated tooth, how we bend the arch wire to fit in there. And come ahead and rotate it further. Now this is an example, like the band, the occlusal surface of these teeth is not very far off. This is a typodont. It's not like you want with it. Anyway, we put a band on there, and it's down a lot further on the mesial of the band than the 6-year molar is down on the distal. And so we don't want this tooth up higher. If we just ran it straight through here, it'd pick this tooth up and it would be hitting the occlusion all the time, and this wouldn't. So to keep the occlusion working good, we just try to get the incisal contacts about the same level across here. And so we take our arch wire and make a bend back here and go in there. Now this is where you have to go in and convert this lower bracket, which was a tube at one time. Now it's a bracket. It has this peeled off of it, you see. And so we peel that cover off of that bracket, and now you're going to have to treat this just like any bracketed tooth. So we have it tied in with a old ligature wire. We ligatured that arch wire to this molar, and then this is a tie-back wire that is like 012. It's slightly larger than the ligature. If you look very closely at that, you can see the ligature wire right here, and the ligature. This is the tie-back, and there is the ligature wire just in front of it, and here's the tie-back wire. So it's ligatured and then tied back, and this is the omega that we built into the wire, which we can tighten this up if we want to close space in there, or just keep it arch wire in the center all the time. Here, this is another blown up section of that. It's a one-to-one shot, but you can see the ligature wire right there. And then this is the tie-back wire. This is 10,000, that's 12,000 wire. And this is a 18 thousandths bracket slot with a 17 by 25 arch wire in there. It's a rectangular wire that's fit down in that slot. That is at least 1,000th clearance in here. Even on an 18-25 wire, you'll have a little clearance, so the slots are slightly bigger than 18 thousandths, but the 18,000 wire will fit into them. So a 17 is got a little more than 1/10 of a millimeter clearance in the arch wire going through there. Now, if you come to the bicuspid, you kind of keep in the bicuspid occlusal surface. This is the buccal cusp of the lower, should fit in the groove up above, and you want it to be lined up pretty good, so you have to go in or out with these teeth to match this up. So in order to keep these molars lined up here, we had to make a slight bend in this wire, which is a second order bend, and now it keeps this molar and the second molar and the first molar lined up along with the bicuspid right here. This is the omega. If you notice, it came out for the omega, and then the arch wire goes straight to here, and it has to bend. So you have to convert this tube in the first molar to be able to tie that arch wire in. And the point is to keep the buccal cusp of the lower teeth in a straight line so that they fit into the buccal cusp, the occlusal groove of the upper molar. The groove of the upper molar would be something wrong in here, you see. That's not an accurate drawing by a long shot. Anyway, there's the deals. Alright, another little trick is using elastic chain. Like if you want to close space in the arch, of course you can just tie the arch wire back and it'll close the space up for you. Or if we want to use elastic chain and close the arch wire, tie it back, you can do it that way also. Now I can hook the elastic chain. Normally you'll start out back here, hook it on one of the medial, the lingual buttons, which we have on all of our lower molars. Then pop the chain through the contact point over here and go under the arch wire and then hook it to the cuspid. And then you pull it and stretch it back to the molar back here. Now if you want this to go straight, you keep the same pressure on this side as you have on the buccal as you do on the lingual. If I want this tooth to turn in that direction as I back it up, I put more force over on this side and less over here, and it'll bring the tooth back but rotate it at the same time. You will also tend to rotate your molar in that direction too, but if you've got a good arch wire in there, that won't hurt anything. You can line that up later on. So that's how we close a lot of times with an elastic chain coming through there. Now this is a case where we've got a kid with a tongue thruster. It could be an adult. We have a lot of adults that we have to put these little fingers on to help in stopping tongue thrusting, and they work. They really do. I had an adult in just yesterday that we've had these on, and she's been wearing them for about 7 or 8 months, and she says her tongue never goes up there against her teeth anymore. She had a pretty bad dental open bite, and she's about 30-something years old. And we've broken this habit on a lot of adults by using these little fingers. They're made out of an old 3-hole stainless steel wire, and the tooth, maybe your lower anterior tooth, something like this, and we put these on the band, and then you spot weld the wire on the band, and it'll be sticking up like this, and then we flow solder over the top of that. This is welded and soldered, so they're hard to get off there. And then we watch where this comes down, like if the upper anterior teeth are in here somewhere. You got to bend this wire so that it comes up fairly close to the palate, but not touching the palate or the teeth up above. Now when the tongue tries to go through here, this wire is sticking right up in there. It is very irritating to the tongue, and people will push it against it maybe 3 or 4 times, sometimes just a couple of times. I had a doctor, was a medical doctor, that he was a bad tongue thruster, and we put those on, and I said, "Don't you tell me exactly what happens?" And he said, "Well, my tongue went up there about 2 or 3 times, and your tongue's pretty smart. It stops going up there and poking this thing." So that's the way we tend to break tongue thrusting habits, is put something that's immediate result if the tongue thrust goes on. And they kind of protrude up like that. And so we band those teeth, so that's really held on there quite tight. You can see the solder joints and the wire, and usually you fit them, the wire's going straight up here, and you bend them at a certain point, and see how much clearance you got. And the wire is kind of annealed after you go in here and solder it. It bends a little easier than you would think. Now, separators are another important aspect of orthodontics. You can use separators for lots of different things, and things that you probably didn't think you can do with a separator, you can do. They give you a little machine, a little plier that you stretch the things out and try to pop them through the space up here, and you just can't hardly get them down through there. But if you take dental floss and run it in one end of the separator and then in the other end like this, now you come over here and pop the dental floss between the teeth, and it'll go between just virtually any teeth, unless they just don't, they're just fused together. It won't, but you can pop dental floss between almost any tooth. Then you slide the floss through and pull the separator through, and you'll see the 2 ends of the separator on each side, and now you work one of them until you pop the separator up. So you can get separators in places with dental floss that you can't start to get them in with one of these little pliers that just stretches them out. Fit over there. Alright, here is a use of this auxiliary tube. Now this is an intruding arch, and it's fit into here. Now this arch comes back here and circles around like that, and you see it comes up here and then goes through this auxiliary tube right there. It comes on out. Whereas your conventional arch wire is coming along here. You put this omega and get it tied back and everything, and then put your intruding wire on top of that. So the intruding wire is up on top of this coming through. Now the intruding wire will be activated way down like that. You raise it up and put it on your anterior teeth. And we use the intruding wire hooked in this auxiliary slot on the bottom and the auxiliary slot on the top too. And this is a very efficient way to level the bite on anybody. Here again, go back to the the putting the dental floss in the, I don't know how that other slide got in there, but anyway, we'll pop the little separator off the tube, run the dental floss through the other side, pop it between the teeth, pull it in between them. Sometimes it'll just pop up in the side, but usually you get both of them underneath the contact point, and then you kind of work it and you can pop this one up. Now if you pull it too hard coming up, it'll jump, the whole thing will jump out through there. And so you have to go real slow, and when one side pops up, then you slice off, and this leaves a separator in between the teeth, something like that. And they're very efficient. We leave them usually a couple of weeks, something like that. Most of the time, if we're just banding somebody, we'll have them back the next week. We leave the separator in there for a whole week, and they'll absorb moisture and swell up during that week, and they open quite a good space in there. You can also upright impacted second molars or wisdom teeth, stuff like that, with separators. Now here we pop this one in between two teeth, and it kind of off to the side. Now here we can place a separator. Now the gingival tissue would be over this, but there's a tooth right down in here, and you've got a wisdom tooth here, and you can put a separator between these teeth, and you can't even see the tooth if you learn how to do this. Now we put the separator, it's on the floss, and this is one end of the floss over here, and this is, the floss is double back here, and it's double back on this side, and we run it over the back of the tooth and pull forward on it. It's just floss, and go back and forth like you're shining a shoe or something here, and work that floss down the neck of the tooth, so it goes down the neck of the tooth. Let me go back and show this. You slide that floss through, and you pull it where the floss is going back and forth down on the neck. You're keeping it tight, and now you pull on one side, and you'll get the separator to slip through that gap. Sometimes you have to use some topical anesthetic, something like this. It's a little painful to get that in there, but it does such a good job that you want to try to use that, learn how to use that. It really helps you. Now we slide the separator in between there, and when we look back, we pop one side up and then the other side up. Here's the dental floss over here, and here's the floss on this side. And we were able to stop it so that the separator is up above here and then goes down below the contact point down here. And it'll open up space in that area, and it'll shove this wisdom tooth or second molar back. You leave these in maybe 2 or 3 weeks. We've got a cavity in this tooth, I know that. So we'll have to address that problem. But I have to get through a regular dentist to do that portion. So that is the way we pop these down. And a lot of times, I'm going to go back to this. Let me go back to this x-ray. I can open this space up and have this tooth actually setting back in here somewhere. And then you just leave it out for a week. Sometimes you just use it some of the way, and it'll push up part of the way, and then you separate it again, and then it'll come on up. So I've brought a lot of impacted second molars and wisdom teeth in the mouth with using nothing but a separator, just sliding it in underneath there. If you can't pop it through on the top, just take the two ends of it over here. They've got the floss on both ends. Let me erase that and start over. So we've got the whole separator going through underneath here, like such. Now you can take the two ends up here and take your floss, pull them together, and just tie a knot up here in them, and tie it about 3 knots in it. Now you've got a double separator down in between there, And I'll guarantee you it'll move this tooth back even if you've got an impacted wisdom tooth in behind it. It'll move this back. Then you slip it out for a week or 2 or 3, and the tooth will come up and forward. Sometimes it'll hit enough where it can go ahead and make its way in, or you may have to redo the separation. But I've brought a lot of partially impacted teeth into the mouth and used nothing but a separator. Dr. White, Larry White, had a fellow send him one of his pearls that he's going to publish a book on hundreds of pearls. But you can take this flexible wire we've got now and take a piece of rectangle and stick it down in here, and the wire's real flexible. Then you can bend it down over the top of this tooth and bond it to this tooth, and this wire will be bent like that, and that will push the tooth back. So that's a trick I've not tried yet, but it looks to have some credibility because the wire we've got now is so flexible, so you can run wire in there, bend it down and hook it and bond it to the tooth. If you just hold it down, you just have to bond it where you're not going to mess up your occlusion too much. Okay, that's the way they separated it. Popped up and we slid it out. There's also ways of separating with brass wire. This is what we used to use years ago, and so I have a spool of brass wire, and you just wrap the brass wire around a steel tube of anything or around a broomstick. It doesn't make any difference. And then slide it off and take a pair of shears and just cut it. Now you got all these little circles that are cut, and you can grab one of those with a Matthew needle holder right here and bend this side back, and you can use this like a needle. So a lot of times you want to sterilize these. If you want to put a point on them, you take a pair of pliers and flatten this in. You can take the wire that's circled like that. If you just mash the heck out of it, you can flatten this part out right in here. Then it would look like a wire coming across here with a kind of a flat end on it. Now you just take that wire and you cut this off like that, and you actually put a point on it. The wire would come out, and now you can actually sew with this. It's kind of like a needle. And so you can go through the tissue and come out on the other side of a tooth and then twist this down, and it makes it work. Several years ago, that's all the separator we had. So it's on a Matthew needle holder like that. We just thread it in between the teeth, and then you take it and twist it down like that, and it's a very efficient separator. And sometimes we still use one. Another separator is the kind of used to get from TP Laboratories. It's a little spring retainer. I think everybody should keep some of these, a little box package of these around. If you can't run the other kind through there, you get these. Now it looks like that you would come in and stick your plier in the middle of this thing, but you don't. That's not the way you put your plier. You want your plier, you get a small, I use a deerback plier with little tips, and we hook in this side. Just catch it right around here and here. You put that part of it on top of the contact point of where the teeth come together. Then open this thing up. You can have this go way on down here. Then you thread this part underneath the bottom, and then you take your plier off, and then this thing has a spring. It's pulling this together about like it is here. As it pulls it together, it separates the two. Here's one. Now your plier will go here and here. You put that on the tooth, open it up, and it works like that. Now we use stripping material We used to get it from Horico. There are different areas you can get it. They kind of recommend, and most, it's about 8 millimeters wide, and get only the fine. Only the fine kind. And these come in about 8-inch strips, and you can cut them in about 3 pieces and strip. And you have on single side and double side. And we use the fine, and the 2-side and the single side. A little stripping material. And when you strip lower teeth, you strip them kind of like if they were stones in a stone arch. Come along like that, like this, like this. Now the little flat contact points will work against each other, kind of like these stones piled up to make an arch, wedge shape like that. So when you put pressure out here, it puts pressure on these contact points. And you can kind of cheat nature. You can have more pressure here and less back here, and still the teeth not collapse there in front.